I want to introduce to you Dr. Matthew Fiedler. Matthew Fiedler is the Joseph A. Peckman Senior Fellow in Economic Studies and a Senior Fellow with the Center on Health Policy. His research examines a range of topics in healthcare economics and healthcare policy. Prior to joining the Brookings Institution in January 2017, Fiedler served as chief economist for the Council of Economic Advisors, where he oversaw the council's work on healthcare policy, including implementation of the Affordable Care Act's health insurance and healthcare payment reforms. Fiedler holds a PhD in economics from Harvard University and a BA in mathematics and economics from Swarthmore College. Dr. Matthew Fiedler, welcome.
Thank you for having me.
I'm so happy that you're here, and thanks for joining us. So I wanted to ask you on to the podcast because I have been breaking down the One Big Beautiful Bill Act for my audience, and I'm trying to keep it in bite-sized chunks, targeted onto one topic at a time, because I think this bill is so huge. It's overwhelming to people, and it's really too much to take in. And as I'm doing this and talking about changes to HSAs and Medicaid and things like that, what I'm noticing is it appears to me that there are some little sugar highs that are kind of put into the bill right on the front side, and then some implications, especially, 2 years down the road, 10 years down the road, that may be quite serious and, potentially negative to the country. So even though I'm describing and tend to prioritize describing what's going to affect somebody, a taxpayer this year, it doesn't feel like it's getting at that larger piece of the bill of what is the big thrust of this bill? What is this bill really going to do to people? And especially breaking that down to the individual listening to this podcast, how is that person's healthcare going to be affected by this bill? So that's why I asked you on. I wanted to just ask you if you can tell us a little bit first about your current moment, where are you joining us from? We're in the middle of a government shutdown. Are you affected by that? And could you explain to us just what the healthcare piece of the shutdown is right now?
Yeah, so I'm not personally affected by the shutdown, but it does affect my work because I've done quite a lot of work over the years on the health insurance marketplaces and particularly the premium tax credits that are at the center of the current shutdown. So, people who buy their coverage through the health insurance marketplaces, many of them are eligible for a tax credit that helps them pay those premiums. Those tax credits were first created back in the Affordable Care Act. They were first available in 2014, but they were then expanded in 2021 as part of COVID relief legislation. And then that expansion was extended in the Inflation Reduction Act a couple of years later. The expanded credits are now scheduled to expire, which would bring the value of the credit back to what it originally was in the Affordable Care Act. The consequences of that are that many people who have become eligible for these credits over the last number of years will no longer be eligible for the credit. And then many people who are already eligible for the credit will receive smaller credits. And so their out-of-pocket premiums in 2026 will be larger than they were before. And, for some people, that'll be an additional financial burden, but the sort of analysts who have looked at this conclude that it will also result in some people concluding that they can no longer afford their coverage and dropping that coverage. So the Congressional Budget Office estimate is that if these credits expire, around 4 million people will become uninsured next year and in the years thereafter, relative to if the credits were extended as they're in effect for 2025.
Got it. Can you repeat that number? You said 4 million?
4 million people. Yep.
Okay. Yeah, it's been hard for me to just keep straight the millions coming from which piece of,
yes.
of this bill. So thank you very much for that. And I'm just curious, and I realize you might not know, but do you have any sense of any progress in these negotiations? You have a sense of what's going on?
My sense is, just what's in the newspapers, which would be, my perception would be there's been very little progress towards reaching some sort of agreement on that. I think on the Republican side, there have been some signals that, maybe they're open to the idea of an extension in some form, but they're very dedicated to the idea that, those discussions won't happen until after the government is reopened. And I think, frankly, many Democrats are concerned that if the government reopens, those conversations will never happen. And so at the moment, what the path forward is not clear. I think it's also the case that if Congress is ultimately going to extend the credits, each day that passes, squanders, I think, some of the benefits that could flow from that. So one of the one of the potential benefits of extending the credits is it probably brings healthier people into the individual market risk pool, and that reduces the unsubsidized premiums. So if Congress had acted 6 months ago to extend the credits, I think we'd be looking at lower premiums, unsubsidized premiums for 2026
Hmm.
than we're ultimately going to end up with. And so, the fact that Congress hasn't acted yet means that, people who don't get subsidies are going to pay more. And for people who do receive subsidies, the federal government is going to spend more than it would have had Congress acted on this in a more timely fashion.
Interesting. Okay. And I've been hearing a lot about like a cliff and, like people getting, statements in the mail of their current insurance
Mhm.
premiums going up. I mean, have you seen things like that yet? Or what's the timing where somebody might expect a letter announcing a thing like that? Like what might people be looking out for and on what timeline?
Yeah. So, open enrollment is about to start on November 1.
Hmm.
And so most people, when that happens, will be able to, so if they already have marketplace coverage, will be able to log into their account and see what their premium is going to be if they remain in the same plan this year. And
Okay.
so, really in the next couple of days, people are going to start to learn what they're looking at next year if the tax credits aren't extended. Exactly when they'll get a bill in the mail from the insurer, frankly, varies by the insurer and by the state. And I think actually one of the challenges with the policy conversation we've been having is that how insurers and different state marketplaces communicate this information isn't always consistent. But for
Mm.
someone who wants to know, what is my premium going to look like next year if the credits aren't extended, they'll be in a position to know that in the next day or two.
Okay, that's great. So this podcast is going to go live on Tuesday, the 4th of November. So as if you're listening to this,
If you're listening, you can now log into your account and you should be able to find out, what your premium would be.
okay. Well, that's helpful. I mean, with, most of the people who listen to this show are self-employed and do have marketplace coverage if they
Mhm,
have coverage. So
mhm.
it's relevant. Can you give us an orientation, knowing that I've done like little chunks, but I would be really interested, most especially from a healthcare standpoint, because I know that's where your expertise
Mhm.
is. But could you give us just like an overview of the new tax bill, the one big beautiful bill, and just like what it does from from a 30,000-foot perspective and especially related to healthcare?
Yeah. So, again, focusing on the healthcare provisions, it's a fairly substantial step towards retrenching the federal role in funding programs that help low and moderate income people afford their health insurance. So, most of the impact is on the Medicaid program, which is a joint state federal program that provides for health insurance for low income people. And then some of the provisions of the bill are focused on the health insurance marketplaces, which we were just talking about.
Yeah.
The CBO's, the Congressional Budget Office's overall assessment is that the bill will reduce federal spending on Medicaid in the marketplaces by about $1 trillion over a 10-year period. And that the consequences of that will be that about 10 million people will become uninsured. So that is the sort of fundamental trade-off in this bill that, Congress elected to make. They concluded that the savings to the federal government of paring back these programs, and we can talk a little bit about how they did that, is worth more than the fact that, as a result of this, 10 million people who would have health insurance under prior policies will no longer have health insurance.
Got it. What are we getting? What are we getting for these great cuts?
So, the rest of the bill both extended some tax cuts that were enacted back in 2017 and due to
Mhm.
expire, and then added some tax cuts on top of that. I think, there's two perspectives, I think, to look at this tax cut package. I think, I will leave some of this to tax economists who focus more on taxes than I do. But I think the general consensus is certainly among tax economists is this is not a well-designed package of tax cuts from the perspective of, improving economic incentives to save and invest. That the, set of ways that this bill is cutting taxes is just not particularly well thought through from an economic perspective. I think it's also the case that the, tax changes in this bill, the benefits skew towards higher income households. And
Mhm.
so I think one of the trade-offs that's being made in this bill is, you know, benefit cuts, both on the healthcare side, but also on the supplemental nutrition assistance program or food stamp program, benefit cuts that will tend to hit low and moderate income households, and tax cuts or tax cut extensions that will, not exclusively, but to a significant degree, benefit higher income households.
Okay. Thank you for that. I will need to put the citation source as a congresswoman who was on a podcast that I love was talking about like breaking down the sort of impact, by income
Mhm,
and saying, she said, so I'm not attributing this right now, I apologize.
mhm,
But it was that the average US family would get about $83 per month in money right away from these tax cuts, but that the top family, so earning over $500,000 per year, will get $165 per day. So $83 a month versus $165 a day. In other words, 15 times more money towards the people earning over $500,000.
mhm.
Does that sound at least?
I mean,
And
orders of magnitude, the tax cuts at for high income households are very, very large, and
yeah,
typical family tax cuts are not that large.
okay. Just want to make sure.
Yeah.
It's hard to get my head around this bill, and I want to make sure that I'm not mishearing it. So, can you talk to me about the cuts to health coverage
Mhm,
and the how of them? So,
mhm,
how are these cuts happening?
yeah. So, again, there are sort of two buckets of cuts, some targeted at the Medicaid program and some targeted at the health insurance marketplaces. About three-quarters of the impact is coming from the Medicaid provisions.
Okay.
Within that, the one of the big provisions is what's often called a work requirement, that's being applied to the Medicaid program. So people, in order to get their Medicaid coverage, are going to be required to show that they're either working or that they fall into one of several exemption categories, like they're going to school or they have certain types of health conditions or so on and so forth, or they'll be disenrolled from the program.
Uh-huh.
That will directly cause some people to lose eligibility for Medicaid coverage, although the number of people who will actually lose eligibility is probably fairly small because most Medicaid recipients are already working or fall into one of the exemption categories in the law. What we have seen, though, when states have implemented similar requirements, is many people who are actually in compliance with the requirement have real trouble getting through the sort of paperwork process with the state to demonstrate that they actually are in compliance. And so they end up losing coverage anyway, even though, in fact, they're still eligible.
Mhm.
And so that is where the bulk of the effect on insurance coverage from this type of policy comes from. There are some people who are losing coverage because, they recently lost a job and so they're no longer working and so they're not in compliance with the requirement. And then there are a lot more people who lose coverage because, they are working or they are enrolled in an education program, but they have trouble getting through the state's administrative process to actually document that fact.
Yeah. Wow. It strikes me. I mean, I read an article that you wrote about Arkansas. There was a bill, a similar, in effect for 9 months situation in Arkansas. And I mean, my impression of this part of the bill, confirm or deny, is that this is sort of almost designed like a paperwork trap, like sort of meant to cut costs by making paperwork so difficult to keep up with that maybe people won't even who should be eligible maybe aren't going to be able to. Is that fair to say?
So I think that will be the consequence of it. I'm honestly
Okay.
not sure that's the intent of all of the supporters of these types of requirements. I actually do think there's a contingent that feels that, so that this is targeted at people who gained coverage for Medicaid under the Affordable Care Act Medicaid expansion. I think there's a contingent of Republicans and conservative policy experts who always oppose the Affordable Care Act Medicaid expansion. They
Mm-hmm.
haven't been successful in fully repealing it. And so creating these additional paperwork requirements is a way to get sort of a more politically palatable way to get partway towards repeal.
Mm-hmm.
I think there are policymakers who sincerely believe that this type of requirement isn't going to cause people their Medicaid coverage. It's going to cause them to, get a job or enroll in an education program or something else.
Mm-hmm.
I think the evidence we have from Arkansas and the other state experiments is that that doesn't happen in practice. That's not
Yeah.
how these requirements actually work on the ground. But I do think there are at least some supporters of these types of requirements who sort of sincerely believe that that's what they're trying to achieve. I think there are also many other supporters who understand that that's not what's going to happen, and view this as a way to sort of roll back a portion of the Affordable Care Act Medicaid expansion.
Got it. Okay, that's interesting. I appreciate the clarification. I just want to have a little sidebar that I want to ask you about, partly because of a crazy thing that happened in my life just last week. My
Mhm.
husband works at startups, and his startup just one day shut its doors, ended, no severance, everybody gone, done and gone. Don't worry about us. My husband happened to have fallen in a manhole cover and come out in a three-piece suit. He has a job that he has kind of moved to very smoothly, but
Glad to hear
everybody
that.
else, like, oh my
Yep.
gosh. He is the luckiest man on this earth. But, a lot of colleagues are in a world of hurt. And I also was, reading that Amazon just shed 30,000 employees just
Mhm.
yesterday. So I'm just, thinking about people like that who maybe were not living in poverty particularly. They just became unemployed, and, it's a pretty stagnant, uncertain job market right now. Can you just tell me how Medicaid works in that sense? Like, are those people who might become eligible for Medicaid? Like, I don't even really know how Medicaid works, to be honest.
Yeah. So it depends on which state you're in, is the first thing, because it is a joint state federal program. So, but most states have adopted the Affordable Care Act Medicaid expansion, which means that anyone with an income under 138% of the federal poverty line, and exactly how much money that is going to vary based on your family size. But for a single person, this number is not quite right, but order of magnitude, $20,000 a year, is eligible for Medicaid. There are still 10 states, mostly in the South, that have not adopted the ACA Medicaid expansion. But in most states, if you're under 138% of the poverty line, you're eligible. Children are often eligible up to higher income levels than that. But that is basically how the Medicaid program works, at least for non-elderly people. For people over age 65, there's another complicated set of rules, but for people of working age, that's basically what the Medicaid program looks like. I will say, in the states that haven't adopted the Medicaid expansion, often adults are not eligible, no matter how low their income is. And
Hmm.
so parents are sometimes eligible at exceptionally low income levels, but adults without children are basically ineligible no matter how low their income is. So,
Hmm.
there are 10 states still where Medicaid eligibility for adults is extremely, extremely limited. But one of the big things the Affordable Care Act did change, and again, in the 40 plus states that have adopted expansion, is to make sure that all low income adults had some source of affordable coverage.
Okay. So if I'm one of those Amazon workers who suddenly became unemployed and I live in one of those 10 states, is my income this year going to be, at this late stage in November, is it going to be too high to be able to get any coverage? Or would I, if I don't get hired for 6 months because the job market is pretty rough, like what might that look like for me?
Yeah, so if you're in one of those 10 states and you don't have income high enough to qualify for marketplace coverage. So if you're above the poverty line, you do
Mhm.
qualify for marketplace coverage, subsidized marketplace coverage in these states. But if you're below the poverty line and you're an adult without children, you probably just don't have a source of affordable coverage. And
Interesting.
so, back in 2021, when there was this sort of during the Biden administration discussion over sort of the Build Back Better legislation, one of the things that was under discussion was federal action to step in and cover what's sometimes called the coverage gap population in these 10 states, to say, okay,
Mhm.
these states have decided not to adopt the ACA Medicaid expansion, despite the fact that the federal government covers 90% of the costs. So maybe the federal government should step in and cover this population directly.
Okay. Interesting. Thank you for that. I appreciate the primer because I needed it. So I've read a lot about shifting costs from the federal to the states in terms of medical coverage, Medicaid coverage.
Yep.
Can you, I don't really understand how that works. Could you explain for me and for the audience just how that's going to work?
Yeah. Yeah. So we were mostly talking so far about one of the big provisions on the Medicaid side, which is
Mhm.
this new work requirement. But another set of changes are changes to what are called provider tax arrangements. And this gets really technical really fast. But Let me try.
Okay.
So the way the operational control of the Medicaid program exists at the state level, but a lot of the money comes from the federal level. In fact, a substantial majority of the money comes from the federal level. And
Mhm.
the way it works is if the state spends a dollar on the program, the federal government depends on exactly what the spending is and who it's on, covers some fraction of that dollar, say, around 60% of the dollar on average. And so states have figured out that if they increase what they pay to their hospitals, that allows them to get additional federal money. So if they increase what they pay to their hospitals under the Medicaid program, that allows them to get additional federal money.
Mhm.
And then if they tax that amount they just paid to the hospital back from the hospital, they've drawn down additional federal money, but they haven't actually had to spend additional state money in order to do that.
Interesting.
And
Wow.
so these types of schemes have functionally allowed states to shift cost on their Medicaid program onto the federal government. And so one of the things the bill does is make it harder for states to shift money in this way.
Hmm.
Now, I think it's absolutely true. And defenders of these types of policies, what they often argue is like, listen, the Medicaid program is never designed to operate this way. And it's, unreasonable to allow states to do this. I think the counter argument is even with these types of arrangements in place, Medicaid is in practice a very lean program. It tends to have very tight utilization controls. It pays healthcare providers much less than other forms of insurance. And as a result, even when people do have Medicaid, they often have more difficulty accessing care than people with private insurance or with Medicare coverage. And it's also the case that states are often make it pretty hard to enroll because they're trying to keep their costs under control.
Hmm.
So while I think one can look at it in the abstract and say, these types of provider tax arrangements are not the way you'd sort of want to finance the Medicaid program in a perfect world, just telling states you can't use these financing arrangements anymore and sort of shifting those costs back from the federal government on the states is potentially going to lead states to do a set of things to their Medicaid programs in terms of tightening utilization controls, paying providers less, making it harder to enroll, that are going to have a set of fairly negative consequences. So, my perspective is I think it would be better if we didn't have these types of financing games in the Medicaid program. But from my perspective, the right answer to that is to get rid of these types of financing games as the bill does, but
Mhm.
then reinvest that money in a more rational set of ways of financing state Medicaid programs so that we don't have the negative consequences for coverage and access to care that
Mhm.
I think, the set of changes in this bill are likely to have.
Got it. Okay. It's funny as you're saying that, it's not the only place I've heard of that. In taxes, there's this thing called the pass-through entity tax,
Mhm.
which is effectively a state by state workaround to the itemized deductions limitation that was previously capped at
Mhm.
$10,000, now at
Mhm.
40,000.
Uh,
So I've seen this show before.
Yeah.
Interesting. So, what kind of effect, though, do you think that this, or do you understand that this will have, that this cost shifting, legitimate, not, we could argue,
Yeah.
but what effect will that have on the people who, don't make those rules and are just trying to get healthcare?
Yeah. So, I mean, I think the expectation from the Congressional Budget Office, at least, is that one of the ways states will respond is by making it harder to enroll and stay enrolled in the Medicaid program. And so some of the sort of overall reduction in the insurance coverage under the bill is probably coming from these provisions. I think other things states will do include sort of reducing how much they pay healthcare providers, tightening prior authorization and other utilization restrictions, and other similar changes that may have sort of consequences for either healthcare providers' bottom lines or for, individuals' ability to access care.
Hmm. Okay. Thank you. So, just zooming out, kind of like wrapping up a little bit, to zoom out, could you just walk me through what some of the key effects on, just a person working in the US trying to get healthcare, like overall from this bill, some changes from different populations that we might expect to see in the
Mhm.
coming years?
So I think there are going to be a lot of low and moderate income people who, because of the changes in enrollment processes, whether that be the work requirement we were talking about, some other changes in eligibility and enrollment processes on both the Medicaid side and the marketplace side that we haven't talked about, are going to find when they're in a period where their income is not very high and they want to get coverage through the Medicaid and marketplace, are not going to be able to do that, and they're not going to be able to sort of keep on top of the sort of set of administrative requirements they need to do in order to do that.
Hmm.
And so, what are the downstream consequences of that? One of the consequences of the implementation of the Affordable Care Act has actually been that we have much better evidence than we once had on how insurance coverage affects both people's financial security and their ability to access health care, and then their ultimate health outcomes. And what that evidence points pretty clearly is, not surprisingly, gaining health insurance substantially reduces the likelihood that people face, very high out-of-pocket healthcare costs. It increases their ability to access care, including both sort of, routine care like doctor's visits, prescriptions, but also sort of more significant care like, a knee replacement or something like that that requires hospitalization. And then it does seem to improve health outcomes. So, for example, there's been research specifically comparing, what happens to mortality rates in states that have adopted the Affordable Care Act Medicaid expansion versus states that haven't adopted the Affordable Care Act Medicaid expansion. And what we see is that the states that have adopted expansion have seen reductions in mortality relative to the states that haven't. And so I do think the, reduction in insurance coverage under this bill is likely to, have material consequences for the health of the people who are losing coverage, including in some cases that, some people will die who didn't have to.
Wow. Thanks for sharing and outlining that. I mean, I don't feel happy about it, but can you just I'm not sure if I sort of covered everything that feels like should be covered to just somebody who's trying to get a sense for themselves by listening to this podcast of like what happened with healthcare.
Mhm.
Is there anything I missed? Anything that you want to add or any commentary?
Yeah. So, I mean, there's a couple of other provisions that I think are worth touching on, particularly on the marketplace side, because we talked
Yeah.
mostly about the Medicaid side.
Yeah.
So, one of the things the bill does is it's going to require more people to submit more paperwork to get subsidized marketplace coverage before that coverage starts. So the way it often works today is people are required to submit proof of their income, and that's then sort of checked against their actual end of year income on their tax return. But that process sort of, people say what they think their income's going to be, their coverage starts, and then they have to sort of provide the income, additional income information over time, so that there's sort of not a gap in coverage when people try to come into the marketplaces. One of the things this bill changes is it requires people to provide additional documentation before their coverage can actually start. And in practice, just given how the marketplaces have processed this information in the past, that's likely to result in delays for some people in actually being able to get their coverage started. And so we're probably going to end up with, more people either never managing to figure their way through that process, but certainly people with sort of delays in getting their coverage started. There's also sort of additional requirements on what types of paperwork people need to submit at renewal that sort of, again, layer on top of the sort of existing eligibility verification processes, and I expect, will cause trip some people up. The
Mhm.
other big set of changes on the marketplace side is there's a set of provisions that remove eligibility for subsidized marketplace coverage from a number of classes of lawfully present immigrants. So
Mm.
undocumented immigrants have always been ineligible for marketplace coverage, including subsidized marketplace coverage, but some categories of legal immigrants are eligible for marketplace coverage. And one of the things this bill does is roll that back in a fairly significant way.
Wow. Okay. Thank you. Thanks for adding that too. I mean, a concern that I have had just as a person who works with people who are self-employed, who often, just you might just get behind in your bookkeeping, and so you might make an estimate for what your income is for the year and just truly truly not realize that your income is radically different from what you forgot what you said it was
Yep.
going to be in November, and here it is rolling up on the end of the year and you're like, "Oh, I think I made a lot more money. I didn't realize that," right?
Yep.
Or, could go the other way.
Yep.
Can you just talk, because that is the population listening to this podcast. Did
Yeah.
you just mention anything those people should be aware about here?
Yeah. So the way it has worked to date is there are limits on, if you receive the premium tax credit during the
Mhm.
year, and then it turns out when you file a tax return, you made sort of more money than you had estimated you were going to make, you're required to repay some of the additional credit you receive, but there are limits on how much you can be asked to repay. And it depends exactly on your income. One of the things this bill did was remove the limits on how much people can be expected to repay at tax time.
Mhm.
So, depending on the situation, that could amount to thousands of dollars of sort of unexpected cost at tax time for people who, had coverage through the marketplaces during the year. I think this is actually another one where there's an interaction with we were talking, this is not in the bill, we were talking about the sort of expanded subsidies that are at issue in the shutdown. That's another place that, the expiration of those expanded subsidies is another place where you could end up with people facing pretty big surprises at the end of the year. Because the way the prior subsidy schedule worked is once you get to 400% of the poverty line, your eligibility for subsidies disappears entirely. So there are people at 390% of the poverty line who are actually eligible for fairly substantial subsidies, often people in high cost areas or people at older ages. Doesn't take much of an estimation area in your income to think you're going to be at 390 and end up at 410% of the poverty line. And then you're on the hook for thousands, or in some cases, even tens of thousands of dollars in subsidies. The current subsidy schedule, because it continues eligible for the subsidies above 400% of the poverty line and then phases out gradually thereafter,
Mhm.
means that some of those types of sort of cliff effects aren't there. So between the fact that the reconciliation bill took away these sort of caps on how much people can be required to repay, and then the changes in the underlying subsidy schedule that we're debating right now, the combination of those things could mean that there are a lot more people with marketplace coverage that are facing fairly big surprises at tax
Yeah.
time.
I just want to tell you that these are my people because artists live in big cities. Artists live in New York. Artists live in San Francisco,
Yep.
in LA. They live in high cost areas. They're self-employed. They often, they can get behind on bookkeeping because they're wearing a lot of hats. And I have had so many moments as a person doing their taxes where, they forgot a 1099. I've already done their, client sort of showing them what they owe for taxes, and it's,
Mhm.
$2,000 or something, and then
Yep.
they're like, "Oh, I forgot this 1099," and so I entered the new income, and suddenly they owe $10,000.
Yep.
And you're like,
Yep.
and the client is like, "What happened?"
All
It
right.
just, like,
Yep.
feels like it doesn't make any sense. Like, this has happened with these these payment caps in place.
Yep.
This issue that, all of you clients listening, if you've experienced this before, this
Yep.
is gonna get more extreme. So it just maybe a good tip for people listening is, like, your bookkeeping is gonna bookkeeping saves lives this year.
Yeah. Yeah.
Um, so okay. Well, thank you so much, Matthew. This has been super helpful and a little depressing if I'm being completely honest with you. So, wanted to ask you, um, because I think a lot of times people, like the listeners of the Sunlight Tax podcast, are working more towards a vision than really for money. I mean,
Mhm.
like, they're working on just making the world a better place in some way. And a lot of the power in that is just when you can make visible and tangible a vision that you have of a better way the world could be, it suddenly becomes possible. Right. And I think that is the power of this kind of work. So, on that note, I wanted to ask you, is there a policy dream that you have? Is there a place in a state in the US, in another country where healthcare policy kind of works as you feel or wish that it could? Something that you could paint for us that is possible.
So I'll say I'm a little bit of an incrementalist by nature, and so huge radical change is not necessarily the way I think about policy change. But I will say, if you look across U.S. states, there are dramatic differences in the share of the population that doesn't have health insurance. The states that haven't adopted the Affordable Care Act Medicaid expansion, which we talked about, tend to be the top of the list in terms of their uninsured rates. And then there are states like Massachusetts that over a long period has invested a lot in making sure that it has a system where everyone can afford and access health insurance that have uninsured rates in the low single digits, which are frankly comparable to what actually, many other countries that have systems we think of as universal actually are achieving in practice. And so
Mm,
I do think within the context of our messy, fragmented, somewhat broken system, it is actually possible to get there.
mhm.
And I think, what are the set of things that one needs to do that? I think the sort of absolute lowest hanging fruit we talked about a little bit earlier is there are these 10 states that haven't adopted the Affordable Care Act Medicaid expansion. Either those states need to step up or the federal government needs to step in and do it for them. I think the sort of set of changes that the enhanced tax credits that we've been talking about did substantially reduce the uninsured rate. And so if the goal is universal coverage, I think extending those needs to be a high priority. And then I think, again, if your view is that you want everyone to have health insurance, I think a lot of the changes that were in HR1 need to be rolled back. I think, frankly, you put those set of things together and you're talking about a national uninsured rate that's probably now into the low single digits, which again is not so far from what we see in other countries. So I don't want to act like that's that sort of easy set of reforms, but it's also one that's like very imaginable. It's a set of things that certainly many US states have done, and that doesn't require the type of sort of root and branch reform to the system that you might expect, would make it sort of politically impossible.
Yeah, that's really cool. Also, shout out to Massachusetts, which is where I was raised. I'm a product of the Massachusetts public school system, and Massachusetts, what I found so funny when I moved to North Carolina, I was in a pottery class and there was a teacher, I kid you not, a teacher in the public schools. When I told her that I was from Massachusetts, she goes, "Oh, Taxachusetts?" And I was like, "I'm sorry, you're a teacher in the public schools. Do you know how your salary gets paid?" Like, but I think that reputation, like your taxes are for something. Massachusetts is a state that really does invest in its people. It takes that really seriously. It puts its money where its mouth is. And I'm a product of it.
I mean, it's remarkable, I think, in this day and age to think of, Massachusetts health reform was passed under Governor Mitt Romney. And so it turned out to, obviously the national politics of this have turned out fairly different, but it's the set of things they did were something that at least once upon a time, was bipartisan. So.
Mm. Well, they say that I'm going to mess up this quote, but they say the things you think will take 1 year take 5, but the things you think will take 10 years take 5. Something like that.
Well,
So
it'd be great if that's true in this case, in my view. So.
I think the culture is movable, and I'm who we're talking to right now is the people who care to move it. So thanks for helping paint that picture for us. Dr. Matthew Fiedler, it's been really a pleasure. Thank you so much for sharing your time and your expertise with us. I now understand a bunch of things that I felt foggy on before. So thank you very much for joining us.
Well, thank you very much for having me.
Awesome. Thank you for listening. If you like the show, please be sure to subscribe, leave a review, and share it with a friend. It really helps. I'm so grateful. My tax guide, Taxes for Humans, is available for pre-order at sunlighttax.com/book. This podcast is for education and entertainment only. Nothing in this episode should be taken as individual tax or financial advice. You can find all the tools, books, and links I reference at sunlighttax.com/podcast.